thoroughly washing hands, don clean gloves in preparation for pre-cleansing of the perineal area. Ensure adequate lighting. Arrange for extra nursing personnel to assist as necessary. The female patient is best catheterized in the dorsal recumbent position. An alternate position for the female patient is side-lying Sims position. The knees must be adequately separated to obtain a clear view of the periurethral area. Open outer packaging of the Foley catheter tray. Remove the tray. Remove the label, directions for use brochure, and orange sticker sheet from the top of the tray and set aside. Place it between the patient's legs. The first step of the catheterization procedure should be a soap and water perineal cleanse. A pericare kit is provided on top of the wrap of the Foley tray with simple instructions. Open the kit and remove the soap wipes and hand sanitizer. Open the packet of soap wipes, remove and unfold them. Cleanse the periurethral area and discard wipes after use. Remove and discard your soiled gloves. Perform hand hygiene with the provided alcohol hand sanitizer gel. Position the tray so that the arrow is pointed towards the insertion site. Remove the band by lifting near the adhesive and unfold the outer wrap. Don the sterile gloves while maintaining sterile technique in an area outside of the outer wrapping. Place the underpad beneath the patient, plastic or shiny side down. Use caution not to contaminate your sterile gloves while positioning the underpad. Position the fenestrated drape over the perineum, exposing the urethral meatus. Advance the tray toward the patient so the outer wrap and underpad overlap. The Sure Step Foley tray is labeled to walk you through each step of the catheterization procedure. Step 1. Open the packet of povidone iodine. Step 2. Pour the solution onto the 3 foam swab sticks to saturate them. Step 3. Attach the syringe filled with sterile water to the inflation port. Please note that it is not necessary to pre-test the Foley catheter balloon. Step 4. Locate the green syringe with lubricant and deposit the lubricant into the tray. Remove Foley catheter from the blue wrap and place it in the lubricant. Step 5. With your non-dominant hand, carefully retract the labia to expose the urethral meatus. This hand is now contaminated and committed to non-sterile activity. Step 6. Using your dominant hand, twist the first swab stick to remove it from the tray and cleanse the labia minora furthest from you with a downward stroke and discard. Repeat on the labia minora closest to you and the area between the labia minora. Step 7. Remove the catheter from the lubricant. Insert the catheter into the urethral meatus, using gentle downward pressure until urine is seen in the drainage tube. Advance the catheter 2 more inches, or around 5 centimeters, and inflate the catheter balloon with the entire 10 milliliters of sterile water provided in the syringe. Only sterile water should be used to inflate the balloon. Remove syringe. When inflating the balloon, observe the patient. If the patient complains about pressure, immediately stop. Deflate the balloon, gently advance the catheter, and inflate it again. Once the balloon is inflated, gently pull the catheter until the inflated balloon is snug against the bladder neck. If successful catheter insertion is not completed, including breaks in aseptic technique, replace the catheter and collecting system using aseptic technique and sterile equipment. If proper catheterization is not accomplished, use a new catheter system. After inserting the catheter, discard all materials in accordance with hospital policy and remove contaminated gloves.